Hi everyone, my name is Kayla McLeod, and today I'll be providing an overview of Module 9, Nursing Ethics. This presentation is for November 1st for Nursing 891. The objectives and outline for this presentation are as follows. Identify and clarify key terms related to ethics, recognize the relationship between ethics and theory, discuss the approaches and frameworks to ethics that can be used in ethical practice, implications for the future of nursing ethics, and lastly, I'll close with some discussion reflective questions. Throughout the presentation, I will ask some questions, but they're just to get your brain thinking and are not necessary to answer in the discussion posts, but can help facilitate your discussion as well. So I'd like to take the time to highlight some key definitions that will be used throughout this presentation and are applicable to ethics and nursing. So first we have ethics, which is matters of obligation, what ought to be done. Nursing ethics, which is an umbrella term for a number of different but related areas of inquiry. It includes guiding nursing practice, reflecting on ethical issues, accounting for values and standards within nursing, and guiding ethical and empirical research and theoretical reflection. Then we have morals, which is principles of right and wrong in behavior, values, which is relative worth, utility, or importance, and moral dilemmas, which is situations of ambiguity and uncertainty. Now, before I move on with the rest of the presentation, I just want to warm our brains up and get everyone thinking and reflecting about what nursing ethics means to you and what it means to the practice of nursing, and what first comes to mind when you think of nursing ethics. Personally, I think of the words good, moral, codes of ethics, things like justice and advocacy. I think of ethics as guiding our nursing practice, and I think of them as highly regarded in the nursing discipline. I also think that they are essential and a very important component to the nursing discipline, especially since we're often taking care of people in their most vulnerable times. So in the first slide, I'll be making a reference quite a bit to our first reading by Yeo, titled Integration of Nursing Theory into Nursing Ethics, in our Perspectives on Nursing Theory textbook. And I'd like to first touch on how in all my thoughts of the word nursing ethics, theory never did come to mind, as I never did think of the link between ethics and theory. However, Michael Yeo's article discusses and explains the relationship between theory and ethics and the importance of recognizing this relationship. Yeo then goes on to explain how there's rich knowledge on the topics of theory and ethics as separate entities, but very little literature on the correlation between the two. In essence, theory and ethics share common themes, but independently of one another. So again, just to get your brains thinking, why do you think there is minimal discussion on the association of theory and ethics? And why do you think it's important to acknowledge the relationship between theory and ethics? Yeo then provides a couple of examples of this disconnect, using Roy's adaptation model and Muskin's ethical foundations of nursing as examples. Roy's adaptation model explains that the goal of nursing is to promote an adaptation in 4 adaptive modes, contributing to health, quality of life, and dying with dignity. But Roy's work doesn't cite any nursing ethical literature, which is interesting considering her work covers some major ethical matters, such as dignity and quality of life. In comparison, Yeo provides the example of Muskin's ethical foundations of nursing, or also called moral problems in nursing, in which James Muskin investigates ethics and moral problems in nursing, such as the nurse-doctor relationship, nurse-client relationship, and the nurse's role in the healthcare team. Yet, as Yeo explains, he doesn't cite any major theorists. I also found this interesting because, touching on previous modules, we have learned that theory is a vital component to guiding practice and frameworks, so it's interesting that no major theorist was mentioned in his work. Point 3 there, as we've discussed in previous modules, the nursing community has begun to recognize the importance of growing and developing the nursing profession and having nursing recognized as a profession with its own body of knowledge and science. And with this increased need to identify nursing as its own entity, we've learned that theory and ethics plays an important role in distinguishing nursing. As Yeo states, a profession must possess a distinct knowledge base, and it also must possess some ethical standards to which its practitioners can be held accountable. Therefore, the need to develop nursing-specific ethics is important for distinguishing the nursing profession. Yeo then explains how the difference between theory and ethics is that theory is interested in and highly regards science and empirics. He explains how society appeals to science and sees science as authoritative and powerful and the route to a legitimacy status. Then on the other hand, we have nursing ethics, which is more interested in values and the nature of the discipline. Finally, Yeo goes on to explain how ethical issues and concepts are often concealed or overshadowed within theories. He uses Royd's adaptation model again as an example of this. In Roy's theory, she discusses the nurse's role in managing stimuli, which are the factors that influence a patient's ability to cope. However, in using the term managing stimuli, it paints a paternalistic picture wherein the nurse is in a privileged position and superior to the patient and exerts control over the patient. As Yeo explains, the nurse manages and the patient adapts. As well, it paints the picture that the patient has little control over their health choices and little involvement or participation in their own care. Now, when we step back and view this from that ethical perspective, we know this completely defies the ideas ingrained in patient-centered care. I mean, it's called patient-centered care for a reason. The patient and their surrounding supports and community are at the center of care and should be involved and participate in planning and implementing their own care, along with the healthcare team and nurse. Next, I included this quote from Yeo, which is, "Could it be that, dazzled by the allure of science and obsessed with being scientific, evaluators have somewhat blinded to questions of ethics and values?" I want to include this quote because I think it really highlights the issue with the disconnect between theory and ethics and how theory often dominates ethics. Now I'll discuss the various approaches that can be taken to understand ethics and guide ethical decision-making. Yeo identified two main approaches, the ethical theory approach and the moral development approach. The ethical theory approach is influenced by medical ethics and moral philosophy, with the main focus being on Immanuel Kant's moral philosophy. Kant's moral philosophy encompasses deontological ethics. Kant's approach to moral reasoning contains universal, absolute principles that focus on duty-based ethics, that we do the right thing because it's our duty or obligation, not because it's necessarily the right or good thing to do. For example, Kant said that telling the truth was an expected duty. Therefore, if someone wanted to kidnap your children and you are aware and they ask you where your children are, it's your moral duty to tell the kidnapper where they are, as you're expected to tell the truth. This is obviously an extreme example, but it also exemplifies how Kant's approach, as well as other ethical approaches, can be misguiding and are not applicable to all situations. You can't apply just any theory to a moral or ethical situation in nursing and expect it to fit. In contrast, the moral development approach, which was based on Kohlberg's cognitive moral development theory, explores moral reasoning in 6 stages, with the final stage being universal principles, in which individuals have developed their own set of moral guidelines. Additionally, the moral development approach includes the influence of an individual's opinions, biases, beliefs, and experiences. However, Carol Gilligan pointed out a major ethical issue presented in Kohlberg's framework. That is, Kohlberg's research included only males, yet Kohlberg said it was applicable to females as well. As well, when applied to females, they often rated lower in the stage of moral reasoning, painting a negative connotation towards women. Gilliland argued, however, that this was a positive thing, determining that women define moral issues differently, calling this the ethics of care, and challenging Kohlberg's norms of ethics of justice. This is just another example of how not all ethical theories are cookie cutter and can be applied to just any ethical or moral situation. Next, McCarthy identifies 3 views on ethics and the application of ethics, including traditional view, theory view, and pluralist view, which is also the view that McCarthy advocates for in her article. I will now just elaborate on these 3 views. So in the traditional view, McCarthy describes it as casting nursing ethics as a subcategory of healthcare ethics. This view holds a belief that there's little difference between how doctors and nurses identify and handle ethical issues. However, the problem with this view is it does not take into account the unique and complex nature of nursing and the unique and complex ethical situations that arise in nursing practice. It's more cookie cutter again, intended for medical practice rather than nursing practice. Next, we have theory view, which McCarthy describes as a view which emphasizes the independent and comprehensive theory of nursing ethics. This view promotes a distinct nursing ethical framework for guiding ethical decision-making in nursing. Criticisms for this view, however, are that since nursing is unique and complex, you can't just simply apply one specific ethical theory to an ethical issue, as ethical issues are too big for one theory to deal with. As well, the idea that applying one specific theory to an ethical issue implies that there's only one ethically correct way to go. Lastly, McCarthy describes the pluralist view, which she advocates for. This view believes in working strategically with multiple frameworks in order to expand the moral agency for nurses and adequately address the diversity within nursing. McCarthy proposes this view to nursing ethics because this view recognizes the complexities that exist within decision-making and because ethical decisions can be difficult and unique from situation to situation, and not one ethical framework would be applicable, but rather various frameworks and various components from frameworks. Lastly, I'll briefly touch on the views of deontology, utilitarianism, and principalism as it applies to ethical practice. So we briefly touched on deontology, which is concerned with what people do, not with their consequences of their actions. The example I provided of this was Kant's moral philosophy, where he believes that universal laws provide the basis for each act. Next, utilitarianism, which is influenced by the works of Jeremy Bentham and John Mill, deems that the determination of whether or not actions are correct depends on the overall balance between risks and benefits resulting from that action. In other words, what is considered moral or ethical depends on if an action benefits the greater good or the greatest amount of people. I've also just attached a short, quirky YouTube video there. It's about 3 minutes long, and it just explains the difference between deontology and utilitarianism really well, I thought. And then lastly, I'll just discuss the view of principalism, which is applied to situations in which two or more obligations hold and only one can be satisfied. This view encompasses 4 key components, which is autonomy, beneficence, non-maleficence, and justice. As well, you may recognize these terms from our Nursing Code of Ethics. So, what does the future entail for nursing ethics? Where do we go from here? How do we know which ethical framework to apply to ethical dilemmas? Firstly, I think it's important to recognize that ethical dilemmas and ethical situations are almost inevitable within the practice of nursing. Therefore, recognizing ethical dilemmas and understanding the approaches that can be taken to resolve ethical issues is critical for nurses. As we discussed in this presentation, no single framework is superior or provides all the solutions to ethical problems. As well, it's important to keep in mind that many frameworks are borrowed or shared from other disciplines, so in order for them to be effective, they must take on a nursing perspective. Moving forward, I think it's important for nursing to develop nursing ethic frameworks that can be applied specifically to the nursing discipline in order to effectively solve ethical issues and guide nurses in ethical decision making. So I'm just going to provide a case study, and I've listed a few questions related to the case study that you can use for your discussion this week. So the case study is as follows. Sandra is 87 and had a bad fall a month ago, resulting in a broken hip requiring surgery. Her rehab has progressed slowly, but she's now about a week away from discharge. She'd like to return to her own condo where she lives alone. However, her son is concerned that with the fall and her age, she's not safe to go back living on her own. He raised this concern with the doctor, and together the doctor, her son, and Sandra discussed the possibility of moving into assisted living. Sandra feels bad for her son and doesn't want him worrying about her, but she doesn't feel the need to live in assisted living. She asks you, the nurse, what should I do? So these are the following questions for that case study. What ethical dilemma or dilemmas exist in this case study? What ethical approach could you utilize in this situation? Please provide rationale. How should the nurse, you, respond to Sandra's question, keeping in mind ethics? Then, if you're not into doing the case study, I have a couple questions here that you could include in the discussion for this week. So the first one, which approach or view to ethics do you find most beneficial for your practice and why? And please explain why there's a disconnect between nursing theory and nursing ethics, and why is this significant? So that's it for my presentation. Thank you for listening to my podcast, and feel free to contact me if you have any questions, and I look forward to your posts and our discussion on this topic throughout the week. Thank you.